Medical Intuitive Insights with your host, Dr. Gloria Warren, is a program that presents topics on medical intuition, holistic opportunities outside of mainstream society, and scientific research as applied today. Topics range from online intuitive readings to interviews unveiling alternative healing modalities and discussing them with inspirational leaders. Dr. Warren is the bridge within holistic arts while stressing the balance between the spiritual and physical self. So now, please welcome the host of Medical Intuitive Insights, Dr. Gloria Warren.
What if the earliest signs of pancreatic cancer are the ones most people ignore? Sound familiar? Could your body already be whispering warnings you haven't learned to recognize yet? And what if the key to catching cancer cells early is simply knowing what to look for? Hello, and welcome to Medical Intuitive Insights. I'm your host, Dr. Gloria Warren, your guide in the space where science meets intuition and where medical knowledge emerges with whole person healing. Today, we're diving into one of the most important, expanding, and often misunderstood cancers of our time, pancreatic cancer. It's often called the cancer that whispers because its early signs are very subtle. But tonight, I'm here to give you clarity, strength, and understanding. This message is for all of you. Prevention, awareness, and empowered decision-making right here, right now. So settle in, breathe deeply, and let's walk this journey together. So what does the pancreas actually do? The pancreas as an organ. It's very powerful, hidden deep behind the stomach, and has two essential jobs, not just one, but two. One, as a digestive function, it breaks down fats, proteins, and carbohydrates. It also has a hormonal function, which helps to regulate blood sugar through insulin and glucagon. So why does the body need this other factor? I'm sure many people have heard of insulin and how it helps with blood sugar. What is glucagon? Glucagon acts as a physiological counterbalance to insulin. Insulin lowers the blood sugar, but glucagon raises the blood sugar. Together, they maintain the glucose homeostasis, ensuring the brain and muscles always have enough energy, especially during times of fasting, sleep, intensive exercise, times of stress, and things of that nature. So we have to think when we talk about cancers and pancreas, we need to all include what triggers the glucagon release in the pancreas or from the pancreas. The pancreas releases it when blood glucose drops. A lot of hypoglycemic patients have a problem with this. It doesn't want to release it soon enough. So another thing is protein intake is high. Like if you're on a high protein diet, it prevents sugar from dropping. So it kicks in. There's acute stress. By the way, that's how these special high protein diets work. It secretes when the protein intake is high. So it prevents the sugar from dropping, but it does drop somewhat to trigger this secretion of glucagon. And in that process, you're using up the fats that are stored in your body more so than what you're eating, or you're probably not eating a lot of fat. So it's the idea that you can burn fat. So there is acute stress. This is another reason why our bodies and the pancreas releases glucagon. It's the fight or flight scenario and increases the glucose needs as necessary. So when stress raises, your glucagon level raises so your body can use up more of what's in your system, more of what's stored. So now we come to the question, what is it essential for? It's obviously for preventing dangerously low blood sugar, maintaining normal energy levels during fasting, and emergency treatment for hypoglycemia. They use injectable glucagon. It tries to trigger your body into using your fat while they're trying to get your blood sugar up. And they try all different things, obviously. So when something goes wrong in this small but mighty organ, the entire body feels the shift. That's why early awareness is so important. Glucagon plays a quiet but surprisingly important role in cancer metabolism, especially because many cancers hijack normal metabolic pathways to keep fueling their rapid growth. Here's a clear explanation for you so we can go on to that. How glucagon relates to cancer metabolism, okay? Remember, you can always pull this up later and watch this video again. Take notes if you like. If you need to talk to me, you can always call me, text me, send me a picture of you, text me, and I will call you back, okay? So although glucagon's not the primary hormone associated with cancer biology, of course, it influences several metabolic pathways that cancer cells exploit to survive, grow, and metastasize. We can think of its role in three major areas. Glucose availability, fuel that fuels the tumors, can be used. Glucagon raises blood glucose through glycogenolysis, glyconeogenesis, and most tumors rely on the what they call the Warburg effect. Cancer cells prefer glycolysis even in oxygen-rich environment. It's glucose at very high rates. So I'm just trying to show you the correlation between, how insulin is emitted by or secreted by the pancreas. You also have glucagon. It's a very important factor when coming to terms with the type of cancers that may be growing in a pancreas. So the glucagon support tumor energy demands in general. It enhances tumor cell survivability. It accelerates proliferation of glucose-dependent cancers. So it accelerates tumor growths, those specific types of cancers. So if you have an extra output of glucagon, it increases glucose levels in your bloodstream, either from stored glucose or what you eat. It fuels the glycolysis and supports cancer metabolism. It also works through the CAMP, is what they call it, protein kinase, signaling a pathway. Cancer cells often hijack these same signals to increase cell growth, prevent apoptosis, modify gene expression, boost lipid and amino acid breakdown for energy. In some cancers, abnormally, they activate PKA signaling associated with tumor progression, metastasized tumors, chemotherapy resistance. There's so many different things. It promotes, though, fatty acid metabolism used by tumors as an alternative fuel. Beyond glucose, in other words, many tumors use fatty acids, ketone bodies. Your ketones will rise if you're on a protein-enriched diet and low carbohydrate diet. So there's so many things to take into consideration if you have symptoms of pancreatic cancer, or perhaps you have a certain level of pancreatic cancer. Amino acids are something else that does inhibit or increases, in this case, increases the cancer development. So tumors use these fatty acids for mitochondrial oxidative phosphorylation and biomass production, survival during nutrients scarcity. So, the tumor is actually striving to live and striving to grow, just like the human body, the human organism, as well as the cellular tissue and the cells within your body, in vitro and vivally. They are all, everything's striving to survive, including the cancers, if they're in your body like this. it's especially important to regulate the glucagon and glucose levels as well in breast cancer, prostate cancer, melanomas even. These cancers are known to thrive on lipid-driven metabolism, with glucagon may indirectly support. So some of the high levels of glucagon actually indicate they're resistant. That is to say, they're linked to insulin resistance, a cancer risk factor, type 2 diabetes, metabolic syndrome, obesity, often hyperglucogenemia as elevated glucagon. It can lead to high blood pressure, high blood sugar, inflammation, increased IGF-1, and cellular oxidative stress. These conditions create a pro-cancer environment. So, the reason why I'm bringing all these things up is you have a good idea this way of what actually can trigger this type of cancer. So a lot of sugar, things like high ketones in your bloodstream. I mean, there's certain triggers that could lead to something like this, like a pancreatic cancer situation. Epidemiologic links exist between hypergluconemia associated with conditions and pancreatic cancer, colorectal cancer, breast cancer, endometrial cancer. So it's not just pancreatic cancer that it is all linked to. The cancers do inhibit or disrupt the glucagon network. Certain cancers can do this. Hepatic glucose production, things can get inhibited. These levels are often elevated. The liver increases in gluconeogenesis. Muscle protein is broken down to supply amino acids, provides tumors a consistent fuel. So it's always a sad scenario. The therapeutic implications, blocking glucagon may slow tumor growth. It depends on what type of cancer is actually in the pancreas, and that's where testing really comes in. You need to be tested, see your medical professional on a regular basis if this is suggested to be part of your problems. They have this glucagon receptor antagonistic drug that can help, a GLP-1 agonist, which suppresses glucagon. There's different things and different ways to starve the tumor. And that's kind of like one of the therapy angles, is to starve the cancer. And that's very effective in many situations. So it is something to be looked at. There's a lot of research involved here. Anti-glucagon therapies, PKA inhibitors, combination metabolic therapies alongside chemo or immunotherapy. So, glucagon basically influences cancer metabolism by increasing systemic fuels, blood sugar, fatty acids, activating signaling pathways that tumors exploit for growth, survival, metastasis. Chronic high glucagon levels may contribute to a metabolic environment favorable to cancer progression. So we do have a little basis on why we get these problems, and that is something to consider. Check out look at your own life and see what's happening there. See what could be influencing the tumor growth. See what can influence the spread. See what types of therapies. Seek out medical professional of some sort. Self-sustainability begins with yourself. So whatever medical professional you decide you want to see, at least see them and start managing this. So we have a commercial break coming up. Pancreatic cancer most often begins in the ducts of the pancreas, creating what we call pancreatic ductal adenocarcinoma. These cells undergo mutations and eventually tumors. So I'm going to walk you through how pancreatic cancer actually develops, what causes these cells to grow rogue, and what early symptoms you should never ignore. So we're going to take this break and we'll be right back.
Mike Zorek, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a six-time national placer, including 2 seconds, 2/3, and 2/4. He also won the Veterans Folk-Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorek, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorek has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Welcome back. I'm Dr. Gloria Warren, and you're listening to Medical Intuitive Insights. Before the break, we explored the vital role of pancreas. Now, let's go deeper into what causes pancreatic cancer and how it begins inside the body. At the core of all cancer is DNA damage. That could be argued somewhat, but I mean, there are people that do get cancer that don't have it in their DNA. So it follows suit that they have it though. And pancreatic cancer is no exception. Every human cell operates according to strict biological rule book of their own. It knows when to grow, when to divide, when to repair itself, and ultimately when it is time to die. Kind of like us, right? This elegant choreography keeps our tissues healthy and balanced. But when DNA becomes damaged, whether from chronic inflammation, long-term exposure to toxins, genetic mutations, obesity, related metabolic stress, such as smoking, heavy alcohol use, or years of chronic pancreatitis, the rule book begins to break down. Now, you could be born with genetic anomalies, but as I've always believed personally, even if something's in your DNA, you always need a trigger, whether it be old age or smoking, heavy alcohol use, and all of these other things and so forth and so on. That trigger can trigger those problems to actually happen, and that's not good. The cells begin behaving like renegades. They grow when they shouldn't, they refuse to die when they should, and they divide without purpose, ignoring the body's regulatory systems. This is why, a tumor may start and then it can grow so fast and so large. It's because they don't have the rule books as the other cells have. So over time, these abnormal cells accumulate and they form what begins as small precancerous changes in the ducts of the pancreas. These may start as lesions, pancreatic intraepithelial neoplasias, tiny microscopic abnormalities that silently progress over the years. Eventually, if unchecked, they transform into a malignant tumor. We were going to have a patient here today, and unfortunately, she had to be with one of her patients. So she has a lot of these precancerous symptoms, And I added them to the list, so you'll be hearing about those because she had a couple things, symptoms that are not on the normal type of list that physicians use. So we'll be hearing more about that. Hopefully she can key in. Her name's Brandy. Hopefully she can key in. If not, though, she did at least text me some of those symptoms, which is great. Anyways, this whole pancreatic situation, it's a big challenge. And the challenge is that the pancreas is a deep organ tucked behind the stomach. So tumors can grow quietly without pressing on surrounding structures until they reach an advanced stage. This is why pancreatic cancer is often called a silent disease. Early cellular damage may take 10 to 20 years to evolve into detectable cancer, yet during that entire window, there may be no obvious symptoms. By the time pain or jaundice appears, or more of the other types of symptoms, the disease has often already progressed. So what are those symptoms? Pancreatic cancer symptoms are notoriously subtle. They often mimic everyday digestive problems. Oh, I got pain in my stomach, and maybe it's not the stomach. It could be behind the stomach. Use your fingertips, see what you think. See a doctor. Things people dismiss as stress, stomach issues, aging, gallbladder issues, or simple indigestion. But the key difference is this. These symptoms persist. They don't resolve with typical treatments. Here are the common and sometimes overlooked signs. Unexplained weight loss. It's one of the earliest signs, most frequent symptom. Tumors alter metabolism, making the body burn calories faster, or sometimes you'll lose your appetite completely. Upper abdominal pain that radiates to the back. As tumors grow, they press in the surrounding nerves and the celiac plexus, so to speak. People often describe this as a deep, boring pain that worsens when lying down and improves slightly when leaning forward. I know Brandy has specific positions she can lay in without getting as much pain. She's very fortunate to know that. A jaundice is a common type of symptom that the cancers bring out because it brings the yellowing of the skin and the eyes, and it's affecting your whole bile duct system, which is correlated to the liver. So the tumor in the head of the pancreas can block the bile duct. Yellow skin, yellow eyes, dark tea-colored urine, pale clay-colored stool, intensive itching. It's from the bilirubin increasing in your bloodstream. So that's why also important to see your medical practitioner, because you need blood tests to look into that. And then maybe if you're getting some of the symptoms, but you don't have pancreatic cancer, it's something they can follow. What is her bilirubin this month? Or compare it to the baseline 2 years ago. Where are we? Where are we at? So they know if they need to look further into the problem. Digestive problems are very common because the pancreas supports the digestion. Cancer can reduce digestive enzyme output, the secretion, and it can cause bloating, gas, nausea, indigestion, feel fuller after eating, or even during the time you're eating. Floating greasy stools is common due to fat malabsorption. Let's just stop there a second. I want to mention this. Pancreas supports digestion. Cancer reduces or can reduce digestive enzymes. Some people that have this digestion, they go on proton pump inhibitors because it's been missed by the medical professional, or perhaps maybe they didn't check the bilirubin, maybe they didn't check something. You need to be open and honest with your medical professional, and you need to know what's going on. So by going on a proton pump inhibitor, what is that? That's like Prilosec, Prevacid. We have various names to those type of drugs. They're wonderful drugs when used appropriately. But remember, the pancreas supports digestion, and cancer can reduce those digestive enzymes. That's a big problem if you're taking this inhibitor that inhibits more digestive production of that enzyme. So that digestion enzyme is even lowered further, which causes further bloating, further gas. You know, a lot of people with pancreatitis, they get very large in the midsection, and they need to be careful what types of stomach medications they take. You know, there's that thing, it's either or. Either it's a proton pump inhibitor you should take, or maybe apple cider vinegar because you're not getting enough digestive enzyme. So these are things to consider. That's where I come in. That's what I do. I help the physicians figure out what they need to do, or I bring things to their attention, or I can help a patient be more informed so they can discuss things with their medical professional. That's where I come. So a lot of bloating involved with pancreatitis itself, and of course cancer. Moves on. Nausea, very common, and indigestion. Early fullness after eating because it's swelling behind the stomach and pushing on the stomach. So your stomach is like it's shrinking here and being pushed out, causing more bloating. The stools, constant or extreme fatigue. This is something that Brandy has a problem with. Combination of metabolic changes, inflammation, malabsorption that leads to persistent exhaustion. See that when you get inflamed, that means a pathogen is involved versus swelling is just fluid in the tissue. Like you can get hit on the arm or something, it can swell up. That's swelling. Inflammation means there's a pathogen involved. And when you have inflammation in your pancreas, that inflammation hinders the blood flow into those areas, and it can hinder your digestion process from your gallbladder or your stomach down into your pancreas and past your stomach, because you're not getting as many digestive enzymes you may need, and it's malabsorption problem. It leads to malabsorption. So you become tired because the nutrients aren't being absorbed. I actually sell a product that increases your absorption of nutrients from your food just because of pancreatitis or pancreatic cancer. It's phenomenal. So new onset of diabetes is a critical red flag. This is something, after all, if the pancreas is swollen, the blood flow is not getting in the pancreas, and what happens? It's not going to provide enough insulin because it's too swollen to actually function correctly. You need good, healthy blood flow in these areas. There are things you can do for that. So that's something too. If you want to talk to me about those things, you can call me. So a lot of the things, diabetes is a big red flag symptom of pancreatic cancer. The tumor interferes with insulin producing cells. I know that Brandy had more than one growth. They're gone now. Thank goodness. Praise the Lord for that. Blood clots, unexplained blood clots. And who would think, hey, I got a blood clot in my leg? Who would think could be correlated to pancreatic cancer? But it can. It can. So pancreatic cancer does increase clotting risks. Sometimes a person's first sign is a clot or a pulmonary embolism without any obvious cause. Loss of appetite, changes in taste. I know that's been a big red flag over the last 5 years for what's been happening. But at the same time, for pancreatic cancer, yes, changes in taste. Back or shoulder pain, by the way, occurs when the tumor presses deeper into the surrounding tissue, perhaps may be caused from inflamed gallbladder or something else. So you got to be careful. That's where you need to see that medical professional so that you can discern, is it from my pancreas, or do I have a swollen gallbladder? Do I have gallstones? This is one of those type of scenarios and areas in your body that you cannot always discern yourself. What is the problem? This is why that medical professional is very important. Remember, self-sustainability begins with yourself. Symptoms matter when they persist for weeks. They occur in somebody with known risk factors, such as smoking, alcohol, and other ones that we mentioned before. So we're going to take our second commercial break. When we come back, I'll guide you through the diagnosis and the best medical treatments available today, from surgery to chemotherapy, radiation, targeted therapy, and a powerful world of clinical trials. This next section is crucial to understand your options. Stay with me. We'll be right back.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Welcome back, beautiful souls. You're watching Medical Intuitive Insights. I am your host, Dr. Gloria Warren. Let's continue our journey, now moving from symptoms to diagnosis and treatment. So diagnosis usually begins with various tests. If you have problems and you've sought out assistance from your medical professional, you need to have certain tests done so that you can get baselines and you can figure out over the time in the course, a medical course that you're taking, is it getting better? Is it actually getting worse? Or is it just my imagination? I don't know. Sometimes I like to think I'm not dealing with anything, and I'm sure everybody else out there has moments like that. So let's look. You can go do the bilirubin in your blood work. And there's also other tests they can do. Their basic chemistry tests and complete blood count with a differential to check blood, different abnormal, see if there's abnormal cells in there and how many, so you can verify and check later. And it's very important, get those baselines. CT scan or MRI, and with pancreas, I prefer first action on the action plan would be ultrasound for me. And for me, I can say I do an ultrasound first. They're amazing. And then if you see a problem, we'll do an MRI. Or maybe the symptoms are getting worse, so I want to just hop right into that MRI. So an endoscopic ultrasound they also do. So, and of course they could do biopsies if they feel that that's what they need. From there, doctors can determine if the cancer is resectable, borderline resectable, locally advanced, or metastatic. So what is resectable versus other categories? To provide full clarity, here is how doctors classify pancreatic tumors. Resectable. That means the tumor is completely removable, no major artery or vein involved in the tumor itself, and it's not spread to other organs. And they would only know that from these other tests, so that's important. And borderline resectable means that a tumor is touching nearby blood vessels like an artery. Okay, but may still be removable with careful planning. In this situation, the surgery can require pre-chemotherapy to first shrink the tumor down, make it smaller so they can get at it more easily without disrupting any major vessel. Locally advanced or unresectable tumor has grown too much into major vessels. Surgery is not possible herself. Doesn't mean that there isn't something they can't do, though, and we'll get to that in a minute. Metastatic means that the cancer has spread to organs like the liver or lungs, a major organ. Surgery would not actually help to control the disease, and that's when it's time to look for other options. But let's go back to the surgery. Say it's resectable of some sort. Surgery such as a Whipple procedure offers the best chance for the cure, but only if caught early. And it can be possible if the tumor must be small enough, confined to the pancreas. And that's a big thing because Brandy's were outside of her pancreas, which she did have some other problems too, which I helped her with those. And overall, things are looking really good right now in her long-term haul here. And we just want to keep it there. The tumor cannot be wrapped around any major blood vessel and not spread to the liver, lungs, or abdominal cavity. Absolutely not, because if you take out the tumor in your pancreas, then how's that going to help your liver, your lungs, and your abdominal cavity? It doesn't meet the criteria for surgeons, in other words. You can't visibly remove all of that cancer. It's just impossible. So when this is done early, survival rates are much higher. Some patients get long-term remission. Surgery, chemotherapy offers the best outcomes we have today. Chemotherapy, there's regimens, and we have different names of different drugs. Fulfurinox or gemcitabine, and there's different drugs that can help slow the cancer, shrink the tumors, and sometimes make surgery possible. So radiation therapy is used only in select cases for shrinking the tumors or controlling the pain. You know, if the pain is really bad, let's say it's metastasized, but the pain is really bad around the pancreas, they could even maybe control some of that pain by shrinking that tumor so it's not pressing on those nerves for the patients. You know, it's like an alternative type of treatment for those things, indirect. Precision and targeted treatments. If the tumor harbors specific mutations, treatments such as what they call PARP inhibitors can be life-extending. And what is a PARP inhibitor? It's a class of targeted cancer therapies that block the enzyme PARP, which cancer cells use to repair DNA damage. As you try to kill you, they're trying to repair themselves. Immunotherapy is promising for patients with specific markers, such as MSI-high cancers that have defective DNA proofreading. They accumulate many mutations, which makes them easier for immunotherapy drugs to target them and destroy them. Why MSI-high matters in cancer treatment. So MSI-high cancers are among the few solid tumors that respond extremely well to immunotherapy drugs. And then, you know, there's, you've heard maybe commercials with Keytruda and nivolumab. These medications release the brakes on the immune system, allowing them to attack cancer more effectively. What they mean by releasing the brakes is it hinders your system from overreacting to anything. So by doing so, your symptoms actually decrease, and it gives your body a chance. Your body can perhaps attack the cancer more rather than like I have allergies. If I took something like that, it would stop my allergies from acting to airborne allergies, but maybe now my body can work harder on killing the cancer cells or the tumor cells. Okay, so that can be a very useful therapy. I know I was on one of those drugs on the team in the pharmaceutical industry, and I was amazed with what I had seen. It was great, but only if used appropriately. You know, in fact, MSI high is one of the first biomarkers for which the FDA approved immunotherapy based on the marker, not the cancer's location. So they don't have to target the cancer's location. So it could be a metastasized cancer. It could be in your blood or whatever, but it does help overall. So MSI high status may occur in not just pancreatic cancer, but colorectal cancer, endometrial cancer, gastric cancer, like with your stomach, small bowel cancer. Pancreatic is less common, but significant when present. So prostate cancer, which we had a show on prostate cancer, I believe it was last week, is the last of our male series. So you may want to look at that. And other tumors that with mismatch repair defects. You know, it's really important to consider too where this cancer has gone from like 1999 to present. I have this company, I don't know, you may have heard me say it before. I'm the CEO of Sustainability Management Institute. And I'm also doing a 10-part series on self-sustainability. And there's so many things in self-sustainability. If you do not know, you can actually be led into getting cancers. So next week, I'll be doing a show on environmental sustainability for self-sustainability. That's number 1 of 10. I'm only going to do the first one on these shows. So it's free. Watch me next week. You're going to really need to hear this because the mortality and death rate from 1999 just to 2023 was approximately 70% increase from 99 to 2023. It's really a sad situation. Historically, an average of nearly 39,000 deaths happened per year from 99 to 2020 nationally from pancreatic cancer. Recent estimates for 2025 forecast about 51,980 deaths from pancreatic cancer in the US alone. I don't even want to go into how many pancreatitis patients we have now. It's like 20-fold or more just since 1999. And there's a reason for that. And that's why I did my series on self-sustainability. It's something you really need to hear. I'm only going to be going into environmental self-sustainability next week. The rest is going to be off-site through my website. So we'll talk about that next week. The incidence has risen so to as mortality rates, reflecting the fact that pancreatic cancer remains very deadly and often diagnosed too late. So the risk survival pancreatic cancer accounts for about 3.3 of all new cancers in the US, based on the 2018 to 2022 SEER survey. The median age of diagnosis is 71 years. Okay, people are getting it in their late 20s even though. That's the median. The median is the middle number. Okay, it's not the average or the mode or anything. You're talking about the median, the middle number. Take the highest age and the lowest age, and that's the middle number. But that doesn't mean people aren't getting it at much less of an age. Most diagnosis occurs in older adults, just like most cancers, but that not necessarily, age is not a necessity to get cancer. 32.3% of new cases are in people aged 65 to 74. Another 25.5%, 75 to 85. Of course, it increases as you get older. 5-year survival remains low. Just 5 to 15 years, 5 to 15% for a 5-year survival. And that's why you have to have early diagnosis and knowing what to look for. There's certain trends, mortality and all of that worldwide, but that's not our main thing, which we're going to do. However, we are going to take another final commercial break. Now, when we return, I'm shifting fully to holistic support, nutritional support, emotional care, energy medicine, herbs. You've got to hear that. Movement, integrative oncology, and the side of healing that support not only the body, but also the mind and the spirit. Stay there. It's right there. We'll be right back.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Welcome back. I'm Dr. Gloria Warren. We now return to the heart-centered portion of our discussion: holistic, integrative, emotional, and spiritual support for patients with pancreatic cancer. One of my favorite things to discuss. So nutrition is very important to consider with pancreatitis as well as any cancer, and especially pancreatic cancer. So food becomes the medicine. Small meals, whole foods, pancreatic enzymes, blood sugar stabilization, and elimination of alcohol and smoking. You know, I do want to mention in our 10-part series, food is one of the topics for that. And please look at eating only holistic, organic foods, whole foods, organic foods, in any way, whether it's meat, vegetable, and non-processed foods, because what's in those things today, you don't want your body to expand the cancer. You want to try and help support your nutritional absorption of healthy things. So the first thing on the agenda here is movement. And whenever you are not feeling well and you have a chronic condition like pancreatitis, or in this case, even pancreatic cancer, you want to do a lot of walking, gentle walking. I don't mean power walking, or unless that's your thing, of course. Yoga, I really believe strongly in yoga and stretching. And Tai Chi supports the lymphatic flow, and there is research that supports that. The lymphatic flow, digestion, metabolism, and emotional grounding. So you can also do those things, get those same effects through yoga. So consider doing those type of things for movement. Mind-body support. Cancers do affect identity, relationships, and inner courage. Think about how it can affect the relationships. You know, if you have any type of cancer, I really think it's a good idea to talk to a social worker or a medical professional of some sort on a regular basis. Because if something is really bothering you, the people around you, they could be oversaturated with hearing it. You know, it's good that they know what's happening in your progression or your recession with whatever's going on, but at the same time, don't overburden them, but let them know, that's all. Tools such as meditation, prayer, breath work, taking deep breaths, holding it there and holding it, and then Counting 3, 4, 5, 6, 7, 8, 9, 10, and going to a calm. Imagery support, healing at a deeper level. These all create healing at a deeper level. I'm a Reiki master, so I do a lot of Reiki on myself. So seeing the light, the ball of light, I remember the monks playing with a ball of light and then feeling it and then pushing it through those bodies and doing healing on yourself. Like if my jaw hurt, I could do healings on myself and do zigzag saw-like things. These are things that people actually can feel when I work on them. They'll have their eyes closed and they'll tell me, "Oh, it feels like you're going back and forth." Yep, I am. So learn it, do it. It does work. Acupuncture helps with pain, nausea, fatigue, neuropathy, and emotional balance. I'm the very big believer in acupressure that you can do for yourself while at home and doesn't cost money. But of course, acupuncture may have a good, just as good or even a better effect depending where your problem is. There's also this one therapy the Chinese used to do in ancient China, and they'd push their fingers in and remanipulate everything in your intestines and everything. And it's just amazing on what it can do for circulation. So there's other things that I'm not mentioning right here and now. Herbal treatments, herbal and supplements are very helpful. Must be monitored for interactions with any chemotherapy or anything you're doing. So whatever you're doing, make sure your physician knows, and also research it yourself. It's self-sustainability. To sustain yourself, you need to know, is there an interaction with this? Check the drug that you're getting for chemotherapy. Go online, check and see what it doesn't work well with. Look at the clinical studies. Go into the company, look at the clinical studies and figure it out. Okay? It's your life. So spiritual, emotional healing. Cancer is a whole person experience. When your body has cancer, it's felt everywhere throughout your body. The cells know. They know. Holistic support allows individuals to move from a fear to an empowerment, from isolation to connecting to everything in your body. Herbal support, my favorite section. So complimentary wellness guide for symptom relief, quality of life, and supportive care. People with pancreatic cancers often experience inflammation, nausea, digestive fatigue, appetite loss, emotional stress. Certain evidence of informed herbs can gently support digestive comfort, immune balance, inflammation reduction, liver support during treatment, energy and emotional well-being, treatment tolerance. Herbs should never replace medical care. However, there are things that you can look into. Just make sure that your medical professional knows what you're taking. Top supportive herbs, turmeric or curcumin. It's anti-inflammatory. It can inflammation and swelling, inflammation and immune support. It can help. Milk thistle protects liver cells, detoxes pathways. Ginger, panax, ginseng, astragalus, holy basil, licorice root, reishi mushrooms, green tea, peppermint, very good for digestion and comforting your stomach. Always consult your oncology team. Some herbs interact with your treatment, so please keep that in mind. In the meantime, I'll do the first show next week on self-sustainability, and it will be your environment. And I go into things that people have never heard before because I do it through research in my company and through the research of what I do here. So if you want to, you can watch that next week here on my channel, Medical Intuitive Insights. If you want to contact me, 715-892-7500. Text. I do give a lot of free advice and directions. And thank you, beautiful souls, for joining me on this journey tonight. Pancreatic cancer is complex and often frightening, but fear dissolves the presence of knowledge, compassion, and empowerment. If you or someone you love is facing this diagnosis, you're not alone. You're not powerless. And you're worthy of healing and having a healing team that honors your body, your emotions, and your spirit. Until next time, I'm Dr. Gloria Warren. God bless all of you, and there for the grace of God go I. Be well, be informed, and be empowered. Till next time.
This has been Medical Intuitive Insights with host Dr. Gloria Warren. Tune in each week as Gloria shares over 40 years of experience and yearns to provide knowledge derived from intuition and research. Wednesdays, 2 p.m. Eastern.